Pharmacare is not a blue issue or a red issue or an orange issue or a green issue or a block issue. It's a human issue. And we know people out there are suffering absolutely every single day. They can't pay for their medications. And they have to make tough decisions. Do I buy food? Do I buy my medications? Do I buy my prescription medication? Or do I buy the ones for my children? So those decisions should not have to be made in a wealthy country as Canada. We have the solutions. It's National Public Drug Plan, Pharmacare for all. Do it now. Ignore us at your peril, because this will be a ballot box issue the next time that we're in an election.
My name's Lagacé Dowson, and I'm with the Canadian Health Coalition, which is a body that includes a number of pan-Canadian unions, civil society groups, and researchers and experts on healthcare and healthcare policy, specifically public healthcare. So as you know, Tommy Douglas introduced healthcare in 1962 to Saskatchewan, which is why we all have a healthcare card and it allows us to go to the hospital. But it's our concern that that access is being rolled back and that people are having more and more difficulty getting the care they need. And we are also really concerned that people are not getting the medication they need, because as soon as you step out of the hospital, you're on your own with your workplace insurance or whatever there is in place. And we know that 1 in 5 people are not getting their meds. They can't afford their prescriptions, they're cutting their pills in half, and they end up getting sicker, and they end up in the hospital, possibly putting a greater burden on the system, the public system. So we're here to ask for the expansion of Pharmacare across the country, and to ask the federal politicians to enforce the Canada Health Act so that provinces don't proceed with privatization, because you shouldn't be able to get care. You shouldn't have to pay for care, and if you don't have money, not get care. That is really not okay. So that's why we're here today.
We know that there is a movement in this country to privatize our healthcare system, privatize the existing, and a reluctance to publicize the other part of it. And what do we know? We know that profit doesn't care. But we care. We care in our old folks' homes and our extended seniors care. We know that the people who are there are trying to do a good job because they care for our elderly. They care for our parents and our grandparents. But they're not supported, and they're not given what they need to do what they need, because it's about profit. Because guess what? Profit doesn't care.
You know, like, we're here on the Hill today trying to make this case with our rally and our meetings with MPs, but the pharmaceutical industry has been up on the Hill lobbying federal politicians 150 times over the last year or so. So there's big money on the line here. There's people's health on the line. This is a life and death issue as far as we're concerned, because if you can't afford your insulin and you're diabetic, what's going to happen to you? What if your kid is diabetic? Like, it's really serious, and we really want to make that case to the politicians that this has to be done. This was all the other healthcare countries that have socialized healthcare across the country, they have Pharmacare. Canada's the only one that doesn't, and we pay way more for our medication, prescription drugs, than almost any other OECD country. So we're here on behalf of our fellow citizens and taxpayers to defend the right to access to medication.
A massive shout out of love and solidarity to healthcare workers all across this country who are holding up the public healthcare system for all of us right now, despite some pretty big challenges: underfunding, understaffing, privatization schemes, and of course burnout. And we're all here today talking to senators, talking to members of government, to demand and to defend public health care for all by placing strings on federal transfers. This is what we want. By enforcing the Canada Health Act. This is what we want. And if provinces do not protect public health care, Ottawa must do so in their stead.
So I think what's popular now is to attack government and talk about government overreach and the so-called nanny state and all this kind of right-wing discourse that has been circulated on YouTube and all these other platforms. But the fact of the matter is the government is the only thing shielding us from corporate overreach. The government, flawed as it is the way in which we get health care. We just got a dental care program for people who don't have money. We're pushing for Pharmacare so people who don't have money or insurance with their employers can get their medication and not have to choose between buying their groceries or taking, paying for their insulin. Like, the government, flawed and messed up as it is the only tool we have to protect people's interests. And talking about government overreach, it means that you have totally bought the line from the corporations who are behind the scenes, pulling the strings, trying to make a buck off everything. Long-term care facilities, where you don't get your diaper changed more than once a week or once, I don't know, you get terrible care because you don't have a lot of money and you're in the low-end access of the long-term care facility, which you're paying for out of your pocket, for example. Or you can't pay for your meds, or you can't go to the dentist unless we introduce a dental care program, which we're in the process of seeing here. Like, these are the things that make a difference in people's lives. So getting all up in arms about the carbon tax, which you get a rebate for, I mean, I don't like the carbon tax, I'm not a fan of taxation. But we have to pay taxes to get these services. The people who aren't paying their taxes are these same corporations who offshore their profits. Our enemy is not the government. The government is messed up and it's manipulated by corporations. The real enemy is corporate power. And what's lacking in the anger and the sort of backlash of people that occupied the Hill during the convoy, the anger that people feel in general at elites, people who go around saying, fuck Trudeau, they are lacking in class analysis. The elites that control the corporations are running the place, and they're using the government as a cover. And we need to not get sucked into that. We, the people, who need public programs and who don't have a lot of money, the only thing protecting us is the government. Do you think those corporations are going to give you free dental care? Do you think they give a damn about whether you get your medication? They only care about their profits, their shareholders, and the C-suite. They are not our friends. We don't need to give them more power. We need to make sure the government is held accountable, that we vote and they give us the programs we need to protect our families and our neighbors and our kids and ourselves.
Leader Jagmeet Singh! I met a young boy, and he was with his parents, type 1 diabetes. And he told me he's got to do all sorts of things anyone who's got diabetes knows. He's got to monitor his blood sugar. He's got to take medication. Sometimes he's going to do injections. And if he doesn't do it, he knows if he misses it, the worst consequence he could die. But he told me the thing that he's most worried about wasn't his illness, wasn't the medication, weren't all the injections. He was worried about how much the medication was costing his parents. This is an 8-year-old boy, and he was worried about costing his parents too much just to stay alive. I've spoken with so many seniors, and it's heartbreaking. Seniors who literally have to choose in this really difficult time with the high cost of rent, the high cost of groceries. They have to decide, do I eat or do I buy my medication? They have to decide, how do I stretch out my medication that I can't afford? Do I cut my pills in half or do I skip a pill? And we all know what happens if you can't get the medication you need. You end up in the hospital. So the fight for Pharmacare is a fight for a healthcare system that works. When we fight for healthcare, when we fight for Pharmacare, we're fighting for that 8-year-old boy, for those seniors. We're fighting to make sure everyone in our country has the right to stay healthy.
So where are we in this fight?
Well, I think we're losing because people like Jordan Peterson and Conrad Black and all these guys, they're going around crapping on so-called government overreach and wokeism and all this stuff. It's all a cover for a corporate agenda of for-profit delivery. These guys are wealthy guys. They don't care about somebody who lives in a tiny little flat in Lower Town, Ottawa, or in South Parkdale in Toronto. They don't have any idea what those people's lives are like. It's all theoretical. They're living in a wealthy people's bubble. But the reality is a lot of people are struggling and they need protection through public programs. They need what is called the social safety net, or they're going to fall into hobo camps like we saw in the 1930s. We've already seen that with homelessness in the country. What we need is to have a critical class analysis when looking at guys like Jordan Peterson and Conrad Black and all of those guys, Tucker Carlson. They are talking as if we're all rich. We are not all rich. We need protection, we need social programs, and we need to vote, and we need to get involved politically, and not just lash out in the easiest possible way. That's really so important, and it's a lesson that people learned in the Great Depression in the 1930s, and I think we have to relearn it.
The Liberals have been promising this for 30 years and have been breaking that promise for 30 years. So that's why we got to fight. We have a fight in front of us right now. I looked the Prime Minister right in the eyes and I said, we need by this March 1st, this deadline, we need the legislation to lay out the framework for universal pharmacare in our country by the March 1st deadline.
How is this fight being fought? Just by purely trying to influence politicians, or are there other means that you're fighting this?
Well, we're having this rally. You know, it's not a huge rally, but it's a rally, and we are trying to get people to come out to various public events and talks on Pharmacare. We had a cross-country speaking tour. We have stuff online. We publish articles. We went and talked to politicians, senators, MPs, and political staff. We even talked to the political staff in Pierre Poilievre's office. Now, Pierre Poilievre comes from a group of people who are basically quietly saying things like, well, we'll have the last health minister ever. Like, they are opposed to public programs. They've bought this whole thing about, you know, government is bad, taxes are bad, public programs are bad, every man for himself. But we know that every man for himself doesn't work. And the fact of the matter is, a lot of us are going to be living on our public pensions when we retire because we don't have any savings. You want to yank the pensions, like the little bit of safety that we have under our feet as we get older? It just makes no sense. Like, if you stand back and think about it, it doesn't make sense. It's understandable that people are angry and frustrated because the elites are failing them, because they're buying this corporate argument. So we need to see through that and organize accordingly, like this rally and others that we've had. And we'll continue to try and exert pressure every way we can. And we need allies. We need people to speak up for the well-being and the welfare of their families, their friends, and their neighbors. Because it is not every man for himself. That doesn't work. It never has, and it won't work now either.
And I want to make sure one thing's really clear. Who do you think benefits and who do you think suffers if we don't move ahead with Pharmacare? There's a very clear line here. If we have universal Pharmacare, that's good for workers, that's good for families, that's good for seniors. If we don't have Pharmacare, who is the only two groups that benefit from not having Pharmacare? Well, corporations is the best answer, actually, because that kind of summarizes it. Good job. Big pharma and big insurance companies. They're the only ones opposed to this. So if the Liberals don't move ahead with their promise on March 1st, that means they're turning their back to working people, turning their back to all of you, and again siding with big pharma and big insurance companies.
What's your outlook on Canada as a nation if we just took a step back from this in terms of just how we're doing as Canadians on not only this issue but so many others? When you can see, I heard, because I just basically heard some speakers talk about the division in this country and how it's never been worse.
I think when the chips are down or when people are in trouble, that's when it's easy to lash out at the guy standing beside you or the immigrant family that just moved in down the street. Instead of looking up and thinking, oh geez, whose interest is it serving that I'm mad about my immigrant neighbor? Or I think that guy shouldn't be making more money than me. The person upstairs, the so-called 1%, is the one who's laughing all the way to the bank. So I think that the contradictions of the class structure are more clear now since the pandemic. A lot of people had a hard time. A lot of people lost their jobs. It's difficult. We have an inflation crisis. We got all these guys increasing the price of groceries, making a buck off of our suffering. So that brings out the worst in people. And the challenge is to not get bitter, not get angry, think analytically, look around to see who's actually doing something constructive. And I would say it's the labor movement by bargaining and sticking up for people and getting them good wages and good benefits. It's the women's movement, sticking up for women and families. You know, it's the civil society groups, patients groups. Those are the people who are actually doing something useful and improving people's lives. Occupying the city of Ottawa, getting really mad, it's understandable, but where did it leave us? It left us really just like feeling sad and weird. We need to be more focused and more constructive and find allies who are actually doing something useful.
Do I have your support that we're going to continue to fight for universal Pharmacare for all? Are we going to keep on fighting to keep our healthcare system public? Are we going to fight back against privatization wherever it is?
This is a political problem. The problem is we are getting hosed by the 1%. That is really the problem. The government is almost like a sidebar issue in many ways, but it's the most obvious one to lash out against. If the pharma lobby is up here 150 times in the last year, and we're only here once, who do you think is going to get their way on the Hill with the politicians, especially the right-wing ones? It's the pharma business. And who's going to get screwed next time they go to the pharmacy and try to fill their prescription, have to pay a copay or whatever it is, and then can't afford their pills? it's me or you or your friends. So it's like you have to stand back and have a class analysis and remain calm. Don't lash out in anger, even though that's tempting. You got to be analytical and critical and skeptical of the line being carried by a bunch of rich guys, the Petersons, Conrad Blacks, Tucker Carlsons of the world. They are having a field day at the expense of people who are really suffering. You got to see through that stuff. It's hard to do, but that's what you got to do.